We're examining the lumbosacral spine. We want to check first the appearance. Is there an obvious scoliosis? Is he listing because of muscle spasm or pain? Are there any obvious abnormalities that we see by inspection? The next thing is to ask him to touch his toes. Go ahead, John, touch your toes if you can. Okay, alrighty. And that's a form of straight leg raising, which we can also do sitting and, of course, supine. Next, we want to check for tenderness. So, is he tender along the paraspinous musculature? Is he tender along the spinous processes? The sacroiliac joints are palpated right here. And the greater trochanters laterally, and make sure we're not missing hip pain that could be masquerading as back pain. Between the sacroiliac joint and the greater trochanter is a sciatic notch, and that's a place where the sciatic nerve is relatively uncovered by muscle, and sometimes patients will have tenderness right there. And can you squat down, John? If you can squat all the way down without too much discomfort, come on back up. We're probably not dealing with a hip problem. And we also want to watch him walk to make sure that he doesn't have an obvious limp or a list to one side or the other. 95% of lumbar disc ruptures involve the lower two levels. We will check the lower three lumbar roots. We'll test the motor, the sensation, and the reflexes. So while the patient's standing, you can test L4 and S1 easily by having him walk on his heels and toes. So John, can you walk forward a few steps on your heels? Good. And walk back on your toes. Okay, good, John. So we have tested L4 motor by having him walk on his heels and S1 motor by having him walk on his toes. We're testing the motor function of the lower three lumbar nerve roots, and we had him walk on his heels and toes to test the L4 and S1 nerve roots. To test the L5 nerve root, which innervates the extensor hallucis longus, we have him extend his big toes against resistance. Lift up hard. So that's the motor part of the lower three nerve roots. The sensory part is L4 innervates the medial side of the foot, L5 innervates the dorsum of the foot, and S1 innervates the lateral and plantar side of the foot. So we can test that sensory portion of the nerve root quickly of the lower three. Reflex-wise, we can test L4, which is the knee-jerk reflexes, and S1 is the ankle jerk. We don't really have a good reflex to test for L5. Okay, while the patient is sitting, you can also check for straight leg raising. And a positive straight leg raising sitting would be when he rears back to try and take pressure off the sciatic nerve as you're extending his knee. You can also do this formally when he's supine by raising his leg. And if he tries to touch his toes standing, that's another form of straight leg raising. While he's sitting, you can check the range of motion of his hips. Make sure we're not missing a hip problem.